Hi, my name is Nidhi Sharma. I'm a women's health physical therapist, and today I'm here to talk to you about interstitial cystitis and pelvic floor dysfunction or pelvic floor problems. Over 90% of people who have the diagnosis of interstitial cystitis or bladder pain syndrome actually have a pelvic floor dysfunction, or at least also have a pelvic floor dysfunction. Pelvic floor dysfunction can look exactly like IC symptoms, and today I'm going to explain to you why. So, to get a diagnosis of interstitial cystitis, bladder pain syndrome, or painful bladder syndrome, all same things, you need to have generally two symptoms. One, you have to have some discomfort that's perceived as a bladder or urinary discomfort in your lower abdominal region. So, in the lower abs or around your pelvic region, you have some pain that feels like bladder pain. And the second symptom is urgency and frequency. So you must have this desire to pee again and again. You might be peeing more than 8 to 10 times a day, or have to pee again and again frequently through the day and night. Or secondly, you may have this urge to pee suddenly that comes on very quickly and makes you run to the bathroom even though you don't have that much pee in your bladder. So, to understand why pelvic floor may be playing a role in the symptoms that present as interstitial cystitis, we're going to look at some of the pelvic floor anatomy and kind of get a lay of the land to understand what might be happening. So this is your pelvis. This would be the bone on the right. This is the bone on the left. This is the pubic bone in the front. This would be your lower back here. This would be your buttocks, tailbone. And when we look inside, there is right behind this bone is the organ called bladder, where your pee collects. Behind that would be uterus, and behind that would be rectum. And if you're a male, you won't have the uterus, but you would have prostate sitting underneath the bladder. When we take these organs out, everything that's red inside is your pelvic floor. So pelvic floor is a big hammock-like muscles that spans the front of your pelvis to back of your pelvis and side to side. Okay, so everything that's red inside and then everything that's red outside is also pelvic floor. So how you can see this bladder sits right here, right on top, literally on top of these pelvic floor muscles. Yeah, and then the tube from which the pee comes out, which is the urethra, comes out here and passes through these small muscles of your pelvic floor. So small muscles of your pelvic floor form a collar around this tube from which the pee comes out, and large muscles of pelvic floor form a basket underneath this bladder where the pee collects. So when these muscles are tight, irritated, spasming, generally unhappy due to many different reasons of your life, they can cause symptoms that look very much like urgency, frequency, and bladder pain. These muscles actually can contract and can create some pressure or discomfort by squeezing the lining of the bladder. And these muscles, the smaller muscles, can actually cause pressure and squeezing of the urethra, much like what happens in UTI, and feel like you have the urgency and frequency to pee again and again. In pelvic floor physical therapy, we work on these muscles to relax and train you to stretch these muscles so they can get away from your bladder and give your bladder space to expand. We also work on these muscles at the opening, to create some space and teach you how to relax these muscles so you can create some space around the opening from which you pee. Like I said, over 90% of people who have the diagnosis of IC have pelvic floor dysfunction. American Urological Association, which is the main body for the symptoms treated called IC, has given A grading to pelvic floor physical therapy. Highest grading for treatment has been given to pelvic floor physical therapy, and only pelvic floor physical therapy. If you have changing in your bladder lining called Hunner's lesion, pelvic floor physical therapy still helps. There is no world where your bladder will be inflamed and the pelvic floor will be spared. However, there is a possibility that your pelvic floor is so tight that it feels like bladder, even though bladder is fine. So there, whether you have Hunner's lesions or not, pelvic floor physical therapy is definitely going to help.